Pathology of the optic nerve. Anatomy. The optic nerve is the second cranial nerve extending from the eye globe to the brain. Embryology. The optic nerve originates from embryonic optic stalk. First nerve fibers form as buds from the retinal ganglion cells at 6 weeks and course centripetally towards the brain. The hyaloid artery enters the substance of the optic nerve before closure of the embryonic fissure. The artery and its sheath regress at birth or shortly after, allowing formation of the optic cup. Optic nerve forms of axons of ganglion cell layer and lies nasal to the optic axis. As optic nerve leaves the globe, it becomes myelinated with increase in diameter from 1.5 to 3 millimeters. Intraorbital portion of optic nerve is 30 millimeters long and runs a tortuous course to optic canal. Axons of optic nerve originate from ganglion cells. Nerve fiber layer is unmyelinated. Nerve fibers enter the optic nerve by making a sharp bend and form fascicles separated by glial tissue, astrocytes, and vascular connective tissue. Myelin, formed by oligodendrogliocytes, proceeds in opposite direction, beginning centrally and progressing centrifugally towards the eye, ending at the lamina cribrosa. Meningeal coverings. The optic nerve is covered by dura mater, pia mater, and arachnoid mater. Subarachnoid space is continuous with central nervous system. Blood supply. The intrascleral and intraocular portion of the optic nerve is supplied through ophthalmic artery, peripapillary choroidal plexus via short posterior ciliaries, perineural plexus in subarachnoid space. The numerous capillaries within the optic nerve give rise to the pink color. Central retinal artery and vein emerge from the optic cup and divide dichotomously. The artery lies nasal to the vein. Lamina cribrosa. Trabeculae contiguous with choroid and sclera. Trabeculae form a sieve-like structure through which nerve fibers pass. Congenital anomalies of the optic nerve. Optic nerve hypoplasia. Congenital underdevelopment of optic nerve. It is sporadic, usually bilateral condition affecting males. Eye may be microphthalmic or normal in size with defective vision. Optic disc is gray with a peripapillary halo, double ring sign. Midline facial and intracranial anomalies are present. Septo-optic dysplasia, congenital hypopituitarism, aniridia, homonymous hemianopia, cyclopia, and orbital encephalomenincocele. Incomplete closure of fetal fissure. Optic nerve coloboma. This is incomplete closure of fetal fissure that could be localized to disc or as a part of more widespread coloboma. It is sporadic or autosomal dominant disorder. In 60% of cases, it is bilateral. Optic nerve pit. Small recess at the rim of the optic disc. It is usually unilateral at the temporal disc margin. It is related to anomalies in fetal fissure closure, like coloboma. Optic nerve pit is associated with localized serous detachments involving the macula. The origin of fluid, cerebrospinal fluid, from subarachnoid space or fluid vitreous. Microphthalmos with cyst. A congenital incomplete closure of fetal cleft resulting in a formation of a microphthalmic eye obscured by the cyst. The condition is usually unilateral. Cyst is lined by gliotic retina and contains glial tissue proliferation with calcification. Eye globe may be normal to totally anomalous. Colobomas with choristomatous malformation. Heterotopic fat, smooth muscle may be present, usually found in congenitally blind eye.